So now it's my turn. I am going to talk about the win-win, what I need when it's needed, or what is needed when it's needed. It's strategies for how we are getting, how we're building our engagement campaign, things that we've learned recently, and what we hope to accomplish. So first, I'm going to start out with a broad picture of what we're trying to achieve with patient and family engagement. We know that in the healthcare system, there's people and information and technology. And what the real trick is getting the right information, knowledge, the right information into the right people's hands when they need it. So we want to make sure that the right information, knowledge, and know-how is being shared with folks, so they can get what they need when they need it. And so how do we do that? Well, we're building a system to do that. And before I start, before I talk about a little more about that system, I want to share with you an example of what that looks like in practice. So this is a real example. Last names are not shared, but of how this system works and how every piece and every action can help lead to somebody getting a resource that they need. So on the left, you'll see Mark in green. Mark is a doctor. He attended our spring 2016 community conference. After that, he heard how much patient and family engagement can help outcomes, can help clinical staff, can provide a service both to patients and families and to the folks who are working to help them. He asked Kathy to be their parent partner, and she said yes. And then she attended a community conference. She started the parent working group, who you'll hear from later, started attending their monthly calls, had a one-on-one with me. A one-on-one is a chance to talk and learn about what you all have going on, what ImproveCareNow has going on, and learn how you can get more involved. In 2018, Kathy became the chair of one of the parent working group, co-chair of one of the parent working group working committees. And then this summer, she said, I am getting all these great things from this, and I need to make sure that other folks that I know are getting involved too, or that they have the opportunity to get access to the same resources that I did. And so they had an event locally. She asked a number of folks if they would sign up for a parent working group and to receive our Circle e-newsletter. Molly is one of the parents who said yes. And a couple weeks later, we sent out a nutrition resource that the Patient Advisory Council is going to talk about later. And after she received it, she reached back out to us and said, thank you so much for providing this information. My daughter is 11 and a half, loves to see and read about young girls with IBD. It makes her feel less alone. And then we asked if we could share it with the community. And so the cycle started again. And my point in showing this is that it is hard to think that Mark in 2016 thought that him asking Kathy to be involved would lead to somebody they had never met getting access to a resource that would help improve outcomes and help improve their quality of life. And so each part of this system led to Molly and her daughter getting access to that resource. We're trying to build and replicate this over and over and over again. And why are we doing that? Well, I talked about the IC and the WINWIN, the information, knowledge, and know-how, and what I need when it's needed. We believe that when patients and families have access to information, knowledge, and know-how, they're able to take greater ownership of their care. Quality of life improves, outcomes improve, and they start to share that information with everybody else. And so everybody starts to learn faster and implement things, learn things. If somebody in Pennsylvania is doing something wonderful, we want to make sure that the care center and the parents and patients and families in Seattle get it as quickly as possible so that they can start to see the benefits from it too. You'll see the same chart that Dr. Coletti shared, right? That we believe that patient and family engagement contributes to improved outcomes. So what does that mean for us? What are we trying to achieve? Well, we know in the ICN network, at ICN care centers, there are about 60,000 patients or parents who could be engaged. They could be receiving this information. Right now, only about 1,738 do, or 1,738 do. So there's a big gap there. And we think that we can only achieve that gap. We can only go from reaching hundreds or thousands of patients and families to tens of thousands of patients and families if we build an integrated system. And we've started to see that work. Over the past year, we have, through local and national partnerships, started, I think, at one of the centers that first tested this is having a watch party tonight, Cincinnati Children's. Through local national partnerships, we saw 684 patients and families sign up for the Circle community. We think we figured out how to get it to work. We went from paper forms to folks using tablets in care centers with nurses and doctors and research coordinators asking patients and families if they want to join Circle. And we learned that, we couldn't have reached those 648 people on a national level without coordinating with local care centers. And so it's the local national partnership that's going to help us get from 1,700 and some odd patients and families being connected to 20,000, 30,000, 50,000. But we knew that we needed to learn more. And so we, last spring, started reaching out to patients and families. We wanted to know more about what resources are most important, how people like to access resources, what topics, and how do we all build a system that connects and shares. All of it is to make sure that all of you can get what I need when it's needed easier. That information, knowledge, and know-how are sharing free or flowing freely between the different people who are a part of the network. So one of the questions, I'm going to talk through a couple of the questions that we asked in that survey and some of the things that we learned from that. One, we asked people to think about how they or their child gets information about managing their health, and then rate each of the following methods. Now, this is a busy slide. I acknowledge that. And would say that there are a couple of things that we took out of here that jumped out. We looked at how people like to receive resources. I think you can see briefly see my cursor, or faintly see my cursor, right here in the center square, and then in the far right. And this was a little surprising to us. We thought that people would choose to get resources from printed resources from their care center. Overwhelmingly, people said that they use online websites, blogs, sometimes emails to get resources that are sent out. But we also know that when asked who they get information from, it's physicians, nurses, and other clinical staff. Now, we know we have to learn more about that. For instance, figuring out what type of information patients and families like to get from clinical staff versus what type of information people go online to find on their own. But we do think we learned something there, and it's part of the reason why we are focusing on things like Circle, where information and resources can be shared digitally, and in offering opportunities to connect online. I know it may not seem groundbreaking that people like the internet, but we think we learned something. We think we learned something there. A few of the other questions we asked: what kind of resources, or in what format? I'm not going to read everything here, and certainly the slides will be available afterwards. And we hope to release a more detailed summary of what we learned at some point, but send it out through Circle. I think we saw trends, and some of those trends are things like general information, things people can learn on their own, and things that allow people to take action, right? So if you look at financial assistance for meds or scholarship opportunities or medications, those are things that people want to find and then to do something with. And so it's not just getting information, it's getting information that helps inform things that they can do to improve outcomes. This is the magic wand question, right? Like, short of a cure, what do you want? You could name anything that you want. Again, reinforces the need for online things and general information. This was actually, one of the things that we were unsure about is when in somebody's timeline of diagnosis should they start getting resources, when does it stop being overwhelming? And we think that we learned that people are asking for resources right away. They want information and resources right away. They're going to get them somewhere. And being able to provide people with a trusted outlet is important. And again, going back to the actionable information, right? A handbook that lists all the possible symptoms, when to treat them at home versus when you need to go in to the hospital or to the doctor, right? So information that helps people take action that can help improve outcomes. And then finally, things people wanted things people wanted when they were first diagnosed, to follow up on the idea of like people getting more information. We have diet mentioned repeatedly. I think one of the other things is we hear again and again is people reaching out and looking for a community of support. And then this is the last time you wanted information, who did you go to for it? And something that's stood out to me is that Facebook groups were mentioned a number of times, and I know many of you listening probably are a part of patient or parent Facebook groups. My guess is more parent Facebook groups than patient, but we know there are some good ones out there. My ask before I move on is if you know of any or have one that you consider to be useful or to give great information, share it in the chat box so everybody else can join and see, or email them to me. We're interested in learning more about how people connect places like Facebook and on social media to get information, and how resources are shared through those methods. So, like I said, we want to learn more, but all the information that we're getting is that people want to connect. They want to connect with information and resources, and we can. And that they want information that's actionable, and that we can help people. We can help people do that right now. If you're sitting next to somebody who is not, doesn't have access to this information, if you know somebody on one of your Facebook groups or through personal relationships, we want to make sure they can get the information they have. And going back to that first slide, I want to talk about how two people can have a great impact. This is Ian and Michelle. Ian and Michelle, one is a nurse and one is a research coordinator. They were some of the first folks who started using tablets to ask to get resources to people in clinic. And there are 139 patients and families who now have access to resources who didn't before Ian and Michelle asked them to sign up for Circle, for the Circle e-newsletter. We know for a fact that those out of those 139 people, there are people who are reading Loop posts on the website. Mary chatted in the box a little bit about our Loop blog. We know that they are downloading resources like the Nutrition Toolkit. We know that they're attending local and national events, and that they're joining the Patient Advisory Council and Parent Working Group, and that they're out finding more information about research on our site. We know those folks are doing that. And so this is how we get from 1,738 to 10,000, 20,000, 60,000, right? Seems like a huge number. But if you can think of these two folks over the course of, between 6 months and a year, provided access to that many more people. If you think about just the number of people on the call tonight, if each of us were able to connect with, even 10 people, that's another almost 400 people who patients and families who have access to those resources. So everybody can make an impact, and you can do it starting right now. That's what we're learning. That's what we've learned over the past year. And there's a need out there for it. About 80% of people who are offered the opportunity to be involved say yes. So I've talked a lot about kind of what we've learned from a kind of an academic standpoint, right? Like, but how do we turn this into action? And so we're going to hear some examples. We're going to hear from Kat and some folks about nutrition. We're going to hear from our friends in Kansas City. We're going to hear from the Parent Working Group. As you're listening to these, think about something that you could implement immediately, even if it's small, and something that you can build long term, and then how you or your care center or the organization you're a part of can help connect patients and families to community, so they can have access to resources, information, knowledge, know-how, to get the win-win, what I need when it's needed.